license. With regard to tear gas, CR in charge 2.2 and 4, evidence has been provided that people with asthma may have attacks precipitated, and in closed spaces asphyxia may occur, especially among the very young and the elderly. These chemicals therefore are not harmless. The reality is that the substances were developed, produced and provided to be administered to people without their consent and against their own will. In charge 5, the purpose of the drug was to capture a person and keep him or her alive so that he can be interrogated for information. This is hardly a good beneficence, non-maleficence argument. With regard to charge 6 concerning the cyanide capsules, Professor Miles concluded, the allegation in the charges is that Dr. Basson from 1982 to 1989 supplied cyanide to special forces of South Africa for them to commit suicide. He obtained the drug, he provided the drug to the commanders, who then dispensed it to the troops. The individual troops, which Dr. Basson himself never examined, knew nothing of their psychiatric or medical condition. Dr. Basson incorrectly believed that the cyanide was like the cyanide we see in TV dramas or in Agatha Christie books, which acts instantaneously, painlessly, and causes the person to suddenly drop dead. In fact, cyanide is a form of medical asphyxiation, which takes minutes to unfold, minutes that include suffering. And finally, Dr. Basson kept this poison in a medical cabinet with other drugs. All these acts strike me as breaches of ethical conduct. The committee rejects the contention that the ethical principles do not apply to the manufacture and use of substances which should not cause death or bodily harm. The committee concludes that it was established on a balance of probability that the conduct under discussion was in breach of established ethical rules. It will at this stage be inappropriate to discuss matters which are mainly relevant to the context of an appropriate sentence. The committee further decides that in the light of all the circumstances, the breaches of medical ethics amount to unprofessional conduct. The decision of the committee, Dr. Basson, in your absence, is that you are guilty of unprofessional conduct as set out in charges 2.2, 4, 5, and 6. The committee will now adjourn to consider the question of appropriate sentence. Thank you.
As a committee, please.